Hello, everyone. Dr. Marco of Centeno Schultz Clinic here, and today we're talking about the lumbar spine. And today is going to just be an overview of some anatomy of the lumbar spine, some things that can traditionally go wrong with the lumbar spine, how it's traditionally managed from a traditional medicine, whether it be steroid injections, nerve ablations. Some people may have been suggested to have surgery. And then we'll also discuss about some of how our unique treatment approaches are a lot different than your traditional surgery, as well as your traditional steroid injections, and how we can ideally be a good alternative to some of those traditional treatment options. So first off, let's talk about some basics. So lumbar anatomy. So your lumbar spine is consisted of 5 different lumbar vertebrae. A vertebrae is the bony part of the lumbar spine, and there's a front and a back to each vertebrae. This pink area is the vertebral body, which makes up the front of it, and this little point all the way up top is called your spinous process. That's sort of the bony process in the back. If you push on your low back right in the midline, that bone you feel is that bony prominence. Then in the middle of that is your spinal canal. That's where all the nerves run from your brain all the way down your spine, and then eventually exit into your extremities, your arms, and your legs. And sandwiched between each lumbar vertebrae is an intervertebral disc, which is essentially your cushion, shock absorber of your spine, and it's sort of like a jelly donut. You've got this nucleus purposus, think about that as the jelly-filled donut. And then the outer rim, the dense dough, is called the annulus fibers. Now, these fibers can be weakened over time, creating some extra stress on the spine, causing disc herniations, annular tears or tears in the annulus, which also can create pain. And then you can create essentially a leaky hole in the vertebrae disc where it leaks out onto nerves, causing some nerve irritation. And then putting those together, you get the functional spine anatomy. So these stacked on top of each other creates the spinal column itself. And then they connect in the front via that vertebral body, which the disc is in between those. On the back side, you also get something called your intra-articular facet injection, which is the posterior backside connection joint between each vertebrae. And that's also a source of pain generators in a lot of patients with low back pain. They've been diagnosed with facet syndrome. Facet syndrome just means these facets are being aggravated and becoming sometimes arthritic or a lot of effusion in there, creating some back pain in itself. But the back itself doesn't just stop there. It's a conduit for basically that protects your spinal cord on all the way down from your brain, all the way down to the base of your sacrum. It sort of protects your spinal cord. So this is basically all your spinal nerves in your low back. And then it's protected by all your lumbar vertebrae and discs. Now, a lot of traditional spine doctors, that's sort of where they stop. They look at this and try to figure out where someone's pain is coming from. Is it coming from the disc? Is it coming from the nerve? Is it coming from the facet joint? Because their tools in their tool belt are limited to only being able to treat those areas. The problem with that, if we look at other components of the spine, there's a lot that goes into it. So if we're looking at the supporting structures around your spine, you're talking about the ligaments around your spine. There's ones that connect all your vertebrae together in the middle, called your supraspinous and interspinous ligaments. And then on the sides, called your intertransverse ligaments. And then your iliolumbar ligament that connects your spine to your pelvic bone. And then your sacrum as well. So all these white areas are ligaments that hold your bone together. And then on top of that, we start layering a bunch of muscles. So these muscles can also be damaged as well. So these also protect your back and protect all these vital organs such as your nerves, your discs, and your joints. The ligaments and muscles help protect all those from getting wear and tear to them. And there's multiple layers upon layers upon layers of muscles that help protect your back and allow you to move and still be as active as possible. Now, if we're talking about facet syndrome is essentially someone with back pain with those small joints in your back becoming arthritic, meaning the cartilage between those two clamshells, it starts to get some wear and tear to it, starting creating pain. And that's typically pain just in the low back. Seems to get worse with extension or rotation. Basically anything that stresses these joints out. They can form bone spurs along the way as well. If you look at traditional pain management, and if you go to a spine doctor, what are the options for facet syndrome? Typically, they'll start with something simple like a corticosteroid injection into those facets, which can help short term from a pain perspective, but long term wise, the pain typically can come back. And over time, research has shown that high dose steroid injections into those joints can actually further advance some of the arthritis. So it can be toxic over time and advance your arthritis. Next from that, it's called medial branch blocks, where they just numb up a test nerve that goes to those joints. If that takes the pain away, then they go ahead and do a nerve ablation, also known as radiofrequency ablation, where they burn the nerve to that joint. Now, burning the nerve to the joint helps with the pain short-term wise, but there's also some downstream consequences of that long-term wise, meaning that nerve also goes to some of those muscles that protect your back. And if they damage the nerve to those muscles, that muscle becomes weaker and atrophies over time, further increasing the stress to those facet joints. And over time, sometimes the nerve ablation stops working. And eventually, if all else fails, the surgeon eventually says, well, let's just fuse it, and then that should take care of the back pain. But a lot of these treatment options over time are just band-aids for your back pain. They're not really addressing the underlying issues or helping it long-term wise. They're just putting a band-aid on it and a band-aid on it, and eventually the band-aid stops working, and then they just fuse it. And another spinal condition is typically seen is sciatica or radiculopathy, where you've got the nerve getting irritated by either arthritis, cause degenerative disc disease, or a bulge or damage to that disc irritating that nerve as it exits. Now, this can basically cause both back pain as well as leg pain down the leg into your butt, hamstrings, and a various, depending on where that nerve goes, can create pain down that leg. So this is a normal top-down view of your spine. That spinous process is all the way in the back there. You have your facet joints, and then your disc up in front, and then sandwiched in between that, you have your spinal column. Now, for sciatica, that nerve gets pinched, damaged, or irritated by whatever mechanism, sometimes a disc injury, sometimes some arthritis, but otherwise symptoms start managing it, and then you go to the doctor. And again, we have two main treatment options there. One, you can do an anti-inflammatory injections, again with steroids, so corticosteroid epidural. And then if that fails, as well as physical therapy and other things stop working, then sometimes it's a surgical option where they go in and actually remove part of that disc. Now, there's also some downside consequences to those. You go in, remove some bone to get access to the disc, as well as remove part of the disc, you're further damaging the spinal column and all those ligaments and all those muscles and all the disc itself. So long-term wise, it puts you at risk for repeat injuries of your spine and repeat damaging to your spine. While it can help short-term wise, long-term wise, there could be some consequences of that from a traditional medicine option. So we've termed the term interventional orthopedic medicine. So interventional orthopedics just means a different way to really practice, to really maximize what we call orthobiologics. So a lot of people have heard about stem cells or bone marrow concentrate that contain stem cells, as well as blood platelet products called platelet-rich plasma. These can be applied into the spine itself, but the way we use it isn't your traditional way. We use it by using a holistic approach, using a four-prong approach. Number one, we look at the underlying issues. So we sit there, examine you, look at all your imaging, and we can tell, well, how stable is the spine? Because stability, if we look at all the ligaments, if those have been damaged, they become a loose lug nut, putting extra stress on the discs and on the facet joints. So why would you treat the facet joint, or why would you change a tire without working on the alignment of the car? So we can address the stability of the spine by simple injections treating those ligaments. Our next approach, we look at the articulation. So those facets, those cartilage loss, we can treat those with, again, blood platelets or bone marrow concentrate or other avenues that sort of calm down some inflammation in those joints and helps preserve the joints as long as possible, as well as we already addressed the stability, so we can take some stress off of those joints so we can get some long-term benefit. Next, we look at the neuromuscular control, so all the nerves. So if the nerves become damaged or irritated, they also shut off some muscles that protect your back. So a lot of times we're treating not just the facets, the ligaments, but also around the nerves, and platelets and growth factors actually help nerves recovery and nerves function. So we would put a full 360-degree approach where we've treated the ligaments, we're treating the joints, but also treating the nerves and the muscles. And then lastly, we look at overall symmetry. So sometimes you might have developed some arthritis, or you may be born with scoliosis. That symmetry sort of is thrown off. So asymmetry in your spine will overload certain parts of your spine, so we need to address those at the same time. This can be done by treating some of those ligaments around your spine, as well as potentially working with a specific chiropractor or physical therapist working on the overall anatomy and alignment of your spine. So this four-prong approach we call the SANS approach is quite unique in the world of spine medicine. We're not just treating, well, what's causing the pain. We're trying to understand why it happened in the first place and start addressing these underlying issues such as the stability, the symmetry, neuromuscular control, as well as the articulations that could be creating the pain. So I appreciate your time, and if you have any questions, if you would like to see if you're a candidate for any of these procedures as an alternative to steroid injection, radiofrequency ablation, or even spine surgery, feel free to give us a call at Centeno Schultz. Here's the number. You could also reach out to us on any of our social media networks. So those links are below. I appreciate it. Have a good day.